Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we have the pleasure to speak to Dr. Brad Goettl, who is the Chief Nursing Officer for the American Nurses Enterprise. And we're going to be speaking about the impact of workforce shortages, workplace violence, and nurse well being on the nursing industry. So, hi, Brad. How are you?
Doing great. Thanks so much for having me.
Of course. Yeah. Thanks for joining us. Y'all do great work at the American Nurses Enterprise. So I'm super excited to be having this conversation with you today. Um, so jumping right in, obviously, there's a nursing shortage that's going on globally, but also in the United States. So I wanted to ask you right off the top, what are some of the economic impacts of the nursing shortage?
Yeah, I'll jump right into that, but I do want to just put a caveat out is there are a lot of people interested in nursing.
Hmm.
And although we do have a shortage, especially in some geographics and regions are impacted more than others, is we honestly have a shortage in training capacity as well. So just like to point that out because that really is part of the solution to the workforce is making sure that we have enough training capacity at our universities. To be able to
Hmm.
get people that are interested and qualified through training programs so they can get out there and take care of our patients. But from an economic standpoint, it is so expensive to have this shortage. We know that one, labor costs are up
Hmm.
across the country, across every single discipline. But as we are short, we have to fill these gaps either with agency nurses or paying overtime, and really that can turn into this cyclical process where people are working too much, they get burnt out, and then they call out, and then we're short. And so, really trying to break that cycle, but we know that the average cost of a turnover of a nurse can be upwards to $40 to $60,000, and that's only going up as labor costs are going up. In a typical hospital with average turnover, that can cost them between $4 and $6 million a year.
Hmm. Absolutely. And I'm sure there's also a boost in like contract labor and overtime and things like that as well to compensate for gaps in coverage too, if I'm right in saying that.
Yeah, absolutely. And hospitals that invest in this, for each percent change that they decrease their turnover, they
Hmm.
can save almost $300,000 a year. So that
Wow. Yeah,
investment in retaining your staff and keeping your staff and investing in your staff really comes full circle.
absolutely. And so, how do those shortages then in turn impact care delivery for patients?
Yeah, great question. You don't have enough nurses to take care of folks. They get spread really thin.
Hmm.
We have a healthcare capacity issue. It's not just happening in the acute care hospital environment, but really all clinical environments. And patients, are often being held all over the hospital while they're waiting for rooms, or there's delays in getting outpatient treatment, and delays in getting elective or semi-urgent procedures. So just access in general
Hmm.
is very impacted by this shortage, but negative impacts to public health. And we know that there are poor outcomes to patients that are being treated at facilities that have nursing shortages or are understaffed. And that can translate to increased pressure ulcers, poor outcomes, falls,
Hmm.
increased mortality rates, and actually even nurse injury because you're not able to have your nurse colleagues help you with lifting, boosting, or needle safety and other things like that.
Hmm. Absolutely. Yeah. And I'm sure they're running around, doing a bunch of different things all at once, and it's hard to maybe slow down. So that could definitely contribute to that as well. So what are your thoughts on innovative staffing strategies that you would recommend to kind of address the nursing shortage as it exists right now to kind of fill the gaps in coverage?
Yeah, as you talk to chief nurses across the country, they're all struggling with this. And the big thing that I caution is um, don't spread your staff so thin and then make that the new normal.
Hmm.
So still have to invest in appropriate and safe nurse staffing, but the big investment is in professional development providing opportunities for non-nurses like techs and LPNs to go back to school so they can stay in the health system. I met a nurse from Florida who told me about her journey and the health system that invested in her throughout her entire career from being a tech and LPN and now an RN. I've seen some really interesting programs related to virtual nursing and how that can augment staffing. It doesn't
Mhm.
replace a nurse, but it can definitely help in scenarios where you need to spend more time with patients. You need to do more teaching, perhaps, or maybe provide some near peer or peer mentoring. Having these virtual nurses are helping in health systems across the country. And I've seen also where they're inviting retirees to come back and serve as preceptors or as clinical mentors. And I think
Mhm.
one of the most important investments is transition to practice programs. So really investing in your nursing staff so that they have the tools prepared to do their job, and that will help with retention all the way around.
Absolutely. Yeah, we've definitely seen some great strides with virtual nursing as an additive feature, as you're saying. So I'm excited to see where that ends up going. So what are some of the most impactful nurse retention strategies that you've seen be successful?
Yeah, that's a great question. And I think investment in professional development,
Hmm.
we all want to grow as professionals, and so making investments, especially like I said, transition to practice programs, but giving opportunities to grow. And that may not necessarily mean into a new position, but to expand your knowledge and grow into areas of interest, and maybe that is leadership or advanced practice. And I believe that that is really helpful at retaining nurses. If you talk to folks across the country, that's almost more important than slight increases in pay is the investment back in your development. Flexibility and scheduling and self-scheduling rise top to the list. Work-life balance is super important. So giving some of that autonomy back to the nurse to be able to help decide when they're going to work. We know we need to fill the schedule. So if we can fill all the slots on the schedule, but allow there to be some autonomy in that decision making so it can best support your family life, I think that that's very important. And then investments in the work environment, specifically a healthy work environment and well-being. And it
Hmm.
should really be incorporated into an organization's strategic plan of how they're going to invest in these spaces.
Absolutely. So, I want to pivot for a moment just to workplace violence because we've all seen the numbers about workplace violence against nurses, especially in healthcare, and they're quite staggering. So, what can both employers and policymakers do to kind of combat workplace violence in healthcare and against nurses specifically?
So the numbers are staggering. Healthcare workers are more likely to be victims of workplace violence than any other profession in the country. So you're more likely to get injured, going to work in the healthcare setting than anywhere else. Health systems should invest in workplace violence prevention plans.
Hmm.
We are advocating on the Hill for OSHA to establish a standard that would make this a requirement for health systems. Some states have already adopted this in their own laws that this would have to be incorporated, but health systems don't have to wait for legislation to adopt these plans.
Hmm.
So being able to invest not only in structural changes that would support workplace violence prevention, but also shifts in culture. So nurses need to have a just culture where they can feel comfortable standing up and reporting workplace violence without fear of retribution. They
Hmm.
need to, that's the only way we're really going to know how big the issue is. And there needs to be a zero tolerance policy by the employers within the health systems to support and protect their nurses. And I know a lot of folks talk about, oh, we should have a metal detector at the door and we should have bulletproof glass or, wearable devices. And I think that those are all really important tools that are in the toolbox to help prevent workplace violence. But the majority of violence isn't violent acts of, what we see all over the news. A lot of times it's, verbal assaults, it's biting, it's scratching, it's spitting, it's other forms of violence that those structural things may not be able to help with. So, having a zero tolerance policy, a prevention plan, and incorporating a workplace violence shared governance committee where nurses are playing an active role in that prevention. And then also being able to communicate to your colleagues, through the medical records and whatnot, to be able to identify patients that have a history of workplace violence, and partnering with your community leaders as well as your local law enforcement to really have a comprehensive plan.
Hmm. Absolutely. I've also heard from several different CNOs that there's kind of this attitude amongst some nurses where they kind of just expect workplace violence to be part of their job. And I think the public also thinks that to an extent. And so I think you're absolutely right that it's going to take a huge cultural shift in the industry to kind of say, like, no, we don't want to have this happen to us at work.
And you
Um,
shouldn't. You shouldn't
yeah.
want, you shouldn't have to deal with that. And it shouldn't be a part of your job, no one's job.
Absolutely, yeah. So, and following on that train, what are some of the ways that nurse well-being can contribute to the sustainability and growth of a healthcare organization?
Yeah, I always say happy nurse, happy patient.
Hmm.
And I think that's very, very true. But a healthy and thriving workforce really leads to retention and increased engagement. And nurses that are more engaged are more likely to contribute productively to the work environment, whether that's growing programs, providing additional education, participating in committee work and shared governance opportunities. Also, word travels fast in the nursing community.
Hmm.
So if your hospital or your health system or the clinical environment is really investing in these spaces, nurses are going to be lined up to come work at your facility. And a strong workforce really does allow you to grow programs that do impact revenue for the health systems. I mentioned this earlier, but if you invest in the nursing well-being and there's retention, you also have improvement in outcomes, which really leads to increased profitability to the health system. So if you have increased satisfaction, decreased mortality, decreased pressure ulcers, decreased falls, improved quality, those numbers are going to translate in patients are going to choose that healthcare environment to seek their medical needs over other organizations.
Hmm. Absolutely. And for other CNOs who are maybe struggling to kind of make the case for prioritizing nurse well-being, because obviously, the CFOs and other members of the C-suite like those concrete dollars, right? So how do you make the financial case to the rest of the C-suite for investing in nurse well-being?
Yeah, absolutely. If you can share with your CFOs that every dollar that you invest in preventing nurse turnover is going to come back tenfold, even more, I think that you can make the case to the C-suite that it's very important to make investments in this area. I would suggest that CNOs that are looking to make the case pull up the American Nurse Enterprise website and take a look at the summary report for reimagining the economic value of nursing. And within that document, it really talks about nurse as human capital versus a human resource and how you can invest in nursing. There's also an opportunity to take a well-being excellence assessment for your facility. And within that assessment, it goes over a lot of areas that you should invest in the outcomes and positive impact of investing in those spaces as well.
Absolutely. Well, do you have any maybe final thoughts or pearls of wisdom for our CNOs who are listening out there in terms of dealing with any of these issues that we've talked about today?
Yeah, we're 5 years out from one of the biggest public health crises in our country, and a
Mhm.
lot of nurses are just starting to grapple and recover from that experience. And we need to invest back in the well-being of our nurses. We need to invest in the work environment, and it's chief nurses that are really going to be the strongest advocate in the C-suite for their workforce. So I encourage the CNOs out there to consider looking at the resources that we have available, reaching out to me if they have any questions, and encourage to support their workforce and improve the work environment for their teams.
Alrighty. Well, thank you so much, Brad, for your time. I'm really grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to our audience for listening. Thank you, Brad.
Absolutely. Thanks for your time and appreciate the conversation.